3 exercises, 12 minutes. One of them could lower your blood pressure by 10 points, and most doctors never bring it up. If you're over 60 and your numbers are still climbing, this video changes what you do next. Don't skip ahead. Here's the truth I share with patients every week. Most people who want to lower their blood pressure, they're trying, they're walking, they're cutting salt, they're taking their medication faithfully, and their numbers still don't move. That's not a willpower problem. That's not a laziness problem. That's an information problem. The exercises most people choose, the ones they read about online, the ones well-meaning friends suggest, they're not targeting the right mechanism. And because of that, they're working hard with very little to show for it. Today, I'm going to fix that. I'm Dr. Aliza Wright, a general physician, and I want to give you 3 exercises chosen for their direct, proven effect on blood pressure. With clear instructions, you can start this week. If this sounds like what you've been looking for, hit subscribe right now. I post videos like this every week for people who want real medical answers in plain language. You deserve that. Before we get to the exercises, I want to explain one thing, one concept. Because once you understand it, the rest of this video clicks into place. Your arteries, the tubes that carry blood through your body, should be flexible. Think of a brand new garden hose. Soft, stretchy. When your heart pumps, the hose flexes a little. That flex absorbs the pressure. Now imagine a hose that's been sitting in the sun for 20 years. Stiff, rigid. When pressure comes through, it spikes. Nothing absorbs it. That's what happens inside your body over time, especially with high blood pressure. Your arteries stiffen, and when they stiffen, your heart has to push harder. Your numbers go up. The medical term is arterial compliance. And here's what most people don't know. The right exercise can reverse this. Gradually, over weeks and months, the right exercise can make your arteries more flexible again, more compliant. And when that happens, your blood pressure drops. Exercise number 1 surprises almost everyone. It's not walking, it's not swimming, it's not yoga, it's isometric hand grip training. Here's what happens in your body when you do this correctly. You squeeze a device, or even just squeeze your own hand into a fist with steady, moderate pressure. Not hard. About 30 to 40% of your maximum effort. You hold it for 2 minutes. During those 2 minutes, the muscles in your forearm compress the blood vessels passing through them. Blood flow is briefly restricted. Your body senses this and responds by releasing vasodilators, natural chemicals that tell your blood vessels to open up and relax. Over weeks of practice, this happens again and again. Your vessels learn to relax more easily. The resting tension in your arteries decreases, and your blood pressure drops. A meta-analysis published in the Journal of Hypertension found that isometric hand grip training reduces systolic blood pressure by an average of 10 millimeters of mercury. In some studies, the reduction was as high as 15 to 20 points. That is comparable to what many blood pressure medications achieve, and you can do this sitting in your living room chair while watching television. Here's how to do it. You'll need a hand grip device, under $10 online, or a firm stress ball or tennis ball works too. Squeeze at 30 to 40% of your maximum grip strength. You should feel real resistance, but you should not be straining. Squeeze steadily for 2 minutes. Hold constant pressure. Rest completely for 2 minutes. Repeat 3 to 4 times. That's 1 full session. Do 3 sessions per week on non-consecutive days. Keep breathing normally throughout. Do not hold your breath. Give this 12 weeks before judging it. Many of my patients see their first meaningful drop around week 8. Exercise number 2 is breathing, specifically diaphragmatic breathing. And I know what you're thinking, breathing, come on. But let me explain the mechanism, because this is one of the most underused tools in cardiovascular health. Your nervous system has 2 main modes. The first is fight or flight, heart rate goes up, blood vessels tighten, blood pressure rises. The second is rest and digest. Heart rate slows, blood vessels relax, blood pressure drops. Your body has a physical switch between these 2 modes. It's called the vagus nerve, and a long, slow exhale, longer than the inhale, directly activates it. You felt this before. Think about a moment when you were nervous or tense. and someone told you to take a deep breath. The relief you felt? That was your vagus nerve responding. Research shows that regular slow breathing practice increases vagal tone, making your body more efficient at shifting into that calm, low-pressure state. Here's how to do it. Find a comfortable position, sitting or lying down. Place one hand on your chest, one hand on your belly just below your ribs. Breathe in slowly through your nose for a count of 4. Your belly hand should rise, your chest hand barely moves. Hold gently for 2, then exhale slowly through your mouth for a count of 6, longer than the inhale. That extended exhale is what activates the vagus nerve most powerfully. Do this for 10 to 15 minutes daily, morning and evening if possible. No equipment, no gym, just a quiet chair and 10 minutes. If you're finding this useful, please share this video right now with someone who needs it. Blood pressure is the silent killer for a reason. Most people don't know what to do. You can change that for someone today. Exercise number 3 is walking, but not just any walking. Interval walking. And here's the difference. A study published in the British Journal of Sports Medicine compared interval walking to continuous moderate walking over several months. The interval walkers reduced their systolic blood pressure by an average of 12 points. The continuous walkers, 6 points. Double the benefit, same amount of time. Here's the protocol. Warm up for 5 minutes at an easy pace. Then alternate, 2 minutes brisk, 2 minutes moderate. Repeat for 20 to 25 minutes. Cool down for 5 minutes, 3 times a week with rest days between sessions. If you haven't exercised in a while, do 4 to 6 weeks of steady brisk walking first. Build the base, then add the intervals. You now have 3 exercises backed by real science. If this is helping you, subscribe right now. Every week I give seniors clear, honest medical information, the kind most people pay a lot of money to hear. This channel is for you. Here's your complete protocol. Hand grip training, 3 sessions a week, squeeze 2 minutes, rest 2 minutes, repeat 3 to 4 times. Diaphragmatic breathing, 10 to 15 minutes daily, belly rises, long exhale. Interval walking, 3 times a week, alternate brisk and moderate, 20 to 25 minutes. Track your numbers, share them with your doctor, give it 12 weeks. These exercises work alongside your medication, not instead of it. The goal is to give your body so much support that you eventually need less. Leave a comment below. Tell me which exercise you're starting with. I read everyone. Subscribe if you haven't. Share this with someone you love who's dealing with high blood pressure. And I'll see you in the next video. 5 foods that quietly raise your blood pressure after 60. Take good care of yourself. This video is educational only. Consult your doctor before starting new exercise. Do not change medications without medical guidance. Patient stories are composites. AI-assisted script.